Imagine this scene. It's a busy Tuesday at your clinic. Your team has seen dozens of patients, providing excellent care and compassion. You've diagnosed illnesses, provided treatments, and offered reassurance. Yet, weeks later, the financial reality hits hard. A stack of claim denials lands on your desk, each one a puzzle of confusing codes and vague reasons. Payments are delayed, sometimes for months, creating a cash flow crunch that threatens your ability to pay staff, order supplies, and keep the lights on. This isn't just a hypothetical scenario, it is a daily frustration for countless healthcare providers across the country. It's a source of immense stress that distracts from the primary mission: patient care. This constant battle with paperwork and payment systems can feel overwhelming. It drains valuable resources and time that could be better spent focusing on medicine. The administrative burden grows heavier with each passing year, as insurance rules become more complex and patient financial responsibilities shift. You might find your team spending more hours on the phone with insurance companies than they do preparing for patient visits. This cycle of providing care and then struggling to get paid for it is not just inefficient, it's unsustainable. It can lead to burnout among your administrative staff and create a sense of financial instability that affects the entire practice. The impact of these delays and denials extends far beyond the back office. When a practice is financially unhealthy, it can affect everything. It might mean postponing the purchase of new vital medical equipment. It could mean delaying necessary staff training or being unable to hire the additional nurse or technician you desperately need to manage patient load. Ultimately, these financial pressures can trickle down and compromise the quality of care you are so dedicated to providing. A practice constantly worried about making payroll is a practice that cannot fully invest in its future or its patients. This is where understanding a crucial, often overlooked aspect of healthcare becomes essential. It's not a new surgical technique or a breakthrough drug, but a process that forms the financial backbone of your entire operation. We are talking about revenue cycle management, or RCM. Mastering this process is the key to transforming that mountain of frustrating paperwork into a steady, predictable stream of revenue. It's about moving from a reactive state of chasing payments to a proactive system that ensures financial stability, allowing you to focus on what you do best: healing people and keeping your community healthy. So, what is this powerful process we call revenue cycle management? Let's break it down into simple terms. Think of RCM as the entire financial life cycle of a patient's journey through your healthcare practice. It is not just about sending a bill at the end. It is a comprehensive system that starts the very first moment a patient calls to schedule an appointment and only concludes when the final payment for the services rendered has been received and properly recorded. It's the financial pulse of your practice, tracking every single step along the way to ensure that you are compensated correctly and efficiently for the valuable care you provide. At its core, RCM is a bridge. It connects the clinical side of your practice, the patient care, diagnoses, and treatments, with the administrative and financial side. Every action taken, from verifying a patient's insurance to coding a procedure, is a critical link in this chain. When every link is strong, the process flows smoothly. However, if even one link is weak, for example, if a patient's insurance information is entered incorrectly at the front desk, the entire chain can break, leading directly to the claim denials and payment delays we discussed earlier. It is a holistic view of your practice's financial health. Let's use an analogy. Imagine your practice is a car engine. The high-quality medical care you provide is the fuel. But revenue cycle management is the engine itself, the intricate system of pistons, belts, and gears that converts that fuel into forward motion. Without a well-oiled and properly functioning engine, all the fuel in the world won't get you very far. A strong RCM process ensures that every part of your financial engine is working in perfect harmony, from the front desk to the billing office, powering your practice forward and preventing costly breakdowns along the road. Understanding RCM means shifting your perspective. It's not a task to be relegated solely to a single person in a back office. Instead, it is a shared responsibility that involves everyone on your team, from the receptionist who greets the patient to the clinician who documents the visit. Every team member plays a role in capturing the necessary information to ensure a clean claim is created and paid. Recognizing RCM as this interconnected practice-wide process is the first and most important step toward unlocking its full potential and securing the financial future of your practice. To truly master revenue cycle management, you need to understand its distinct stages. Let's walk through the 5 key phases of this process. The first stage is pre-registration and insurance verification. This happens before the patient even steps into your office. When they call to make an appointment, your staff should be collecting all necessary demographic and insurance information. The crucial step here is proactively verifying their insurance eligibility and benefits. This helps you understand what their plan covers, what their copay or deductible is, and if any pre-authorizations are needed for the visit. Getting this right prevents surprises for both the patient and your practice later on. The second stage is patient registration and charge capture. This occurs on the day of the visit. When the patient arrives, your front desk staff confirms the information gathered during pre-registration and collects any upfront payments like a copay. After the patient sees the clinician, the charge capture process begins. This is where all services, procedures, and supplies are documented and assigned the correct medical codes. Accurate and thorough documentation by the clinician is absolutely vital here. This information becomes the foundation of the medical claim, and any errors or omissions can lead directly to a denial. Third, we have claim submission and adjudication. Once the patient visit is coded, the billing team generates a claim and submits it to the insurance payer, either directly or through a service called a clearinghouse. The clearinghouse scrubs the claim for errors before sending it to the insurer. The insurance company then receives the claim and puts it through their adjudication process. This is where they review the claim against the patient's policy and their own payment rules to decide whether they will pay, deny, or request more information. This is a critical waiting period where the fate of your payment is decided. The fourth stage is payment posting and denial management. If the claim is approved, the insurance company sends a payment which must be accurately posted to the patient's account. But what if the claim is denied? This is where denial management becomes crucial. Instead of just writing it off, your team must investigate the reason for each denial. Was it a coding error, a problem with eligibility, missing information? By analyzing the denial, you can correct the claim and resubmit it, or appeal the decision if necessary. This proactive management is essential for recovering revenue that would otherwise be lost. Finally, the fifth stage is patient billing and collections. After the insurance company has paid its portion, any remaining balance, like deductibles, coinsurance, or non-covered services, becomes the patient's responsibility. Your practice must then generate a clear, easy-to-understand statement and send it to the patient. This stage also includes managing patient inquiries about their bills and, if necessary, following up on unpaid balances through a structured collections process. A positive and transparent patient billing experience is key to maintaining good patient relationships while ensuring you receive final payment for your services. Section 4. Avoiding the pitfalls. Common mistakes that sabotage your revenue. Even with a basic understanding of the revenue cycle management stages, many practices, still fall into common traps that can seriously undermine their financial stability. One of the most prevalent mistakes is treating revenue cycle management as exclusively a back-office job. When the front desk staff, nurses, and clinicians aren't trained to understand their role in the revenue cycle, critical errors are bound to happen. For example, if a receptionist fails to scan a new insurance card or a physician forgets to document a specific procedure, the billing office receives incomplete information. This forces them to chase down details, delaying the claim and increasing the chance of denial, a problem that actually started long before the bill was even created. Another significant pitfall is failing to actively